The course of treatment depends on the type of lymphoma a person has and the stage it has reached. Indolent or slow-growing lymphoma may not need treatment. Watchful waiting may be enough to make sure the cancer does not spread. If treatment is necessary, it may involve the following. Biologic therapy. This is a drug treatment that stimulates the immune system to attack the cancer. The drug achieves this by introducing living microorganisms into the body. Antibody therapy. A medical professional inserts synthetic antibodies into the bloodstream. These respond to the cancer's toxins. Chemotherapy. A healthcare team administers aggressive drug treatment to target and kill cancer cells. Radioimmunotherapy. This delivers high-powered radioactive doses directly into cancerous B cells and T cells to destroy them. Radiation therapy. A doctor may recommend this type of therapy to target and destroy small areas of cancer. Radiation therapy uses concentrated doses of radiation to kill cancerous cells. Stem cell transplantation. This can help restore damaged bone marrow following high-dose chemotherapy or radiation therapy. Steroids. A doctor may inject steroids to treat lymphoma. Surgery. A surgeon may remove the spleen or other organs after the lymphoma has spread. However, a cancer specialist or oncologist will more commonly request surgery to obtain a biopsy. Read more about the most severe stage of lymphoma. Risk factors. Different risk factors can increase the risk of both types of lymphoma. Non-Hodgkin lymphoma. Risk factors for non-Hodgkin lymphoma include age. Most lymphomas occur in people aged 60 years and older. However, some types are more likely to develop in children and young adults. Sex. Some types are more likely in women. Men have a higher risk of other types. Ethnicity and location. In the U.S., African American and Asian American people have a lower risk for non-Hodgkin lymphoma than white people. Non-Hodgkin lymphoma is more common in developed nations. Chemicals and radiation. Nuclear radiation and certain agricultural chemicals have links to non-Hodgkin lymphoma. Immunodeficiency. A person with a less active immune system has a higher risk. This may be due to anti-rejection medications following an organ transplant or HIV. Autoimmune diseases. This type of disease occurs when the immune system attacks the body's own cells. Examples include rheumatoid arthritis and celiac disease. Infection. Certain viral and bacterial infections that transform lymphocytes, such as the Epstein-Barr virus (EBV), increase the risk. This virus causes glandular fever. Breast implants. These can lead to anaplastic large cell lymphoma in the breast tissue. Body weight and diet. The American Cancer Society (ACS) has suggested that overweight and obesity may have some involvement in the development of lymphoma. However, more research is necessary to confirm the link. Hodgkin lymphoma. Risk factors for Hodgkin lymphoma include infectious mononucleosis. The Epstein-Barr virus (EBV) can cause mononucleosis. This disease increases the risk of lymphoma. Age. People aged 20 to 30 years and those 55 years of age have a higher risk of lymphoma. Sex. Hodgkin lymphoma is slightly more common in males than females. Family history. If a sibling has Hodgkin lymphoma, the risk is slightly higher. If the sibling is an identical twin, this risk increases significantly. HIV infection. This can weaken the immune system and increase the risk of lymphoma.